Hi, welcome to this month's Vocal Wellness Chat with Nats. I'm Dr. Wendy LeBorgne, and this month we're going to talk about preventative wellness in singers. And we've talked a little bit about this in the past, but one of my initiatives and one of my goals as a voice pathologist has been to do preventative wellness specifically with vocal athletes. So starting way back in about 2001 and slightly before that, there was a proposal set forth to Cincinnati Conservatory by myself regarding preventative wellness screenings for their vocal athletes. And it was met with great discussion. And since that time, I've been screening as part of a team their incoming freshmen, master's degree students, and doctoral students who want screenings to assess the baseline health. Now, the reality of this is that no athlete, even at a junior high school level, is going to be allowed or permitted to play sports without a baseline physical. And the physical is to look at two main things. One, it's to look at structural integrity. So are there any acute injuries or abnormalities to the system? And the other aspect is to look at function. So just to give you an example, my 12-year-old son is a swimmer, and they are no longer allowed to participate in any sports, whether it be cross country or swimming. He does both, with actually out signing a document releasing that we are aware of sudden cardiac death. And his junior high school had cardiologists come in with EKGs, and for a fee, these students could undergo an echocardiogram as well as an EKG. So we're looking both at the structure of the heart to make sure the integrity, the actual system is working appropriately, and then we look at function, like does the rhythm of the heart tell us anything? So the purpose of vocal screenings for my vocal athletes is very, very similar. What we want to think about is looking at structure. Do the vocal folds look healthy? With that said, we know that after 15 years of screenings, that about 35 to 50 to sometimes some of the reports are saying up to 70% of elite performers do not have normal vocal folds, but they function very normally. And therein lies a little bit of challenge because if there is a problem with the vocal folds, i.e. they're not perfectly pearly white and smooth and straight, voice teachers sometimes get concerned that there's a problem and that they should be doing something to fix this problem. But when we think about functionality, what we want to think about is, can this singer or actor do and meet the vocal demands of their given genre for the length of time that they need to do it consistently? So if their performance demands dictate that they perform 3 operas over a 5-week period, 3 times a week for 5 weeks, are they able to vocally withstand the demands of those performances, even if they have slight abnormality like swelling in the mid-chords or reflux? Because reflux is often considered a pathologic or unusual finding. It certainly is not considered a completely normal larynx. So, when we think about screenings, what does that mean? One, it can simply mean that your students get checked out by either an ear, nose, throat physician or by a voice pathologist or a specialized speech pathologist who can determine whether the structure, which really falls in the realm of otolaryngology or ear, nose, throat, or the function, which is really what voice pathologists do, to see how things work. And that's why we work as a team. I would highly recommend, if possible, that students get this done either in coordination with their university, or if they're in high school, or even if they're in college, that they can see someone locally that's within their insurance bracket, and that they can have paid by insurance, just like you would get a physical. I also tell people to keep an eye out around World Voice Day, which is April 17th, I believe. I'm sorry if I don't have the exact date. It's mid-April. And sometimes some of the voice centers around the country will actually allow for free screenings or free strobe screenings on certain times of the year. You can contact your local otolaryngologist or voice center. And if you're in a place that doesn't have easy access to a big center, which I think a lot of places don't have this specialty care, one of the things you can at least do is ask and find where there is the closest place for stroboscopic evaluation. Let's back up just a moment to tell you some of the differences between physicians and voice pathologists or specialized speech pathologists, and how they fit in the world and who's part of the team. So singing teachers and singers themselves are often our gatekeepers. They are aware when something is wrong with their voice, and similarly, they can make the recommendations to either see an ear, nose, throat physician or to see a voice pathologist or specialized speech pathologist. Just like physical therapists, most states have direct access to speech pathology, but insurance will dictate whether that requires a primary care referral or whether it requires a referral from an ear, nose, throat physician, or whether you can directly have a referral from a singing teacher to a speech pathologist. And each state is different and each insurance company is different, so I would encourage you to check with your specific provider as to whether you can have direct access to a speech pathologist or if you have to see a physician first. Almost always, your report is going to go back to someone. So we want this followed in some chain of care, whether it's a primary care physician, a nurse practitioner, or an ear, nose, throat physician. We also get referrals directly from gastroenterologists, pulmonologists, and allergists. So those are people that I typically will see referrals from, as well as from pediatricians. So any of those can work. To give you an idea how the relationship works, for those of you who aren't familiar, is that I think of the otolaryngologist or the ear, nose, throat physician as being parallel to an orthopedic surgeon for an athlete. So your otolaryngologist is very similar to your orthopedic surgeon for a physical athlete. So they're going to see those physicians when there is an acute injury, when there is an illness, or when they're detecting something is a problem. Oftentimes, our very high-level orthopedic surgeons and our otolaryngologists will work with a team. So their therapists become their physical therapists, or in the ENT world, that becomes voice therapists or specialized speech pathologists. So in both worlds, those are sort of the parallels. Your therapists are actually looking at function. So the physicians are providing a medical diagnosis. They are treating the injuries, whether it be medically, meaning they're giving you medication, or surgically, if it warrants surgery, and they're providing that diagnosis. The speech pathologist or the voice pathologist is looking at how that pathology impacts performance. So just because you have a sprained ankle doesn't mean you can't run on it. And just because you have a vocal fold lesion doesn't mean you can't sing 8 shows a week on it and do it in a fairly healthy way. In the singing world, just like in the sports world, one of the things that we see is that the structure is actually pretty normal. So we say, oh, you know what? It doesn't look like you have any nodules. you've got a little bit of reflux, there's some dehydration, so I don't see anything wrong or any reason why you're having this problem. And that's not an uncommon thing that may happen from a physician standpoint, because they're looking for something that they can actively treat with medication, surgery, or potential rest, depending on what the situation is. When we look at it from a voice pathologist standpoint or a specialized speech pathologist standpoint, we're looking at, all right, you don't have any specific lesions, and I'm just taking this case, but you're still not functioning normally. You're experiencing vocal fatigue. You're experiencing pain in the throat. You're experiencing tightness when you're done performing. You have loss of high range, but there's no real reason for that, other than maybe we have some muscle tension or muscle pattern issues that are less than efficient, which are creating this problem. So similar to running on a sprained ankle for a period of time, if a singer sings on an imbalanced system for a period of time, you start experiencing other symptoms: jaw pain, jaw tension, neck problems, whatever it may be. Or those problems may be actually what starts some of the vocal issues. So that is the role of the speech pathologist. Let's back up for a moment even further to what kinds of training these folks have and who do I go see if I'm having a problem. So again, this is often dictated in today's society by insurance. If your insurance dictates that you see your primary care physician before you can see a specialist, you would need to do that before you see an ear, nose, throat physician. An ear, nose, throat physician is a specialized medical doctor. So when physicians come out of their medical school training, they then spend additional years either training as a primary care physician, as a gastroenterologist, as an otolaryngologist, as a pediatrician. So the gamut of what happens after medical school starts to subspecialize their training. So you come out of medical school very much as a generalist, and then you begin your specific training. If you take otolaryngology, you spend another several years training as an otolaryngologist. Beyond otolaryngology, there are then fellowships and specialties beyond that. So you can become, after you're an otolaryngologist, a neuro-otologist who does specifically ears with neurologic problems. You can become a fellowship-trained laryngologist. And those are people who spend additional time in training specifically on the larynx. You can become a pediatric otolaryngologist, where you have general otolaryngology and then you do a pediatric otolaryngology fellowship. You can do an airway training. So there are all of these additional trainings that start to even further subspecialize. So we have medical doctors, then they specialize into their different categories, then they can subspecialize beyond that. So this super duper specialty for singers and larynx is actually a laryngology trained fellow under an otolaryngologist. So that's their fellowship training. For speech pathologists, the minimum basic training is a master's degree in either speech pathology or communication sciences and disorders is often the degree program, but it either is typically a master's degree, an MA, or an MS, a Master of Arts or a Master of Science. Similar to our physicians, master's degree in speech pathologists, or master's degree speech pathologists also come out as generalists. So in a master's degree program in speech pathology, most people take maybe one voice or voice disorders course. The rest of the time is spent in articulation, neurocognitive development, dysphagia or swallowing. We see stroke patients. So that all falls within a master's degree. After you finish your master's degree in speech pathology, you then apply for a clinical fellowship year. And that clinical fellowship year, where you can't become a certified speech pathologist until you finish what we call your C's, which are your certificate of clinical competence. That takes 9 months after you finished your master's degree that you spend in a designated area. There are very few voice clinical fellowships across the country, and they rotate year to year. So just because you have a speech pathologist does not necessitate that they understand a lot about the voice. Similar to just because you have an otolaryngologist, it doesn't mean they always understand a lot about the voice. So when you're looking for providers, you want to make sure that they are specific for singers so that you get the best care possible. Similar to if you were an athlete and you went to an orthopedic surgeon, they can subspecialize in shoulders or knees. Our physical therapists do the same thing. So our physical therapists become certified in specific areas and they maximize care for their patients. So that's what we want to look for when you're starting to look for providers for you or your singers. I always encourage my singing teachers to come with their students if they'd like to the evaluation so that the teacher can also provide information to me related to what they're hearing in lessons or lack of progress or things that are abnormal, because as I'm sure you all know, what you tell a singer and what they hear and then what comes out of their mouth might be very different from day to day and morning to afternoon. So you want to make sure that everybody's on the same page, and then whatever is provided to them by either the ear, nose, throat physician or the voice pathologist is accurately relayed back to the singing teacher. The other thing I might ask as a singing teacher is that if you send a student for a medical evaluation by an otolaryngologist or a voice pathologist, is if you would like information back about that student and you are not able to go with the student, ask the student if they would be willing to sign a medical release, because in our world we are only allowed to provide information about patients between providers that are the same provider for the same patient. So I can share information back with a gastroenterologist who has referred a patient to me, and I can provide that information back to a primary care physician for that same patient and an ear, nose, throat physician if the patient requests that. But because singing voice teachers don't fall in the same HIPAA guidelines as the medical professionals, we always ask for a release from the patient if they would like their information shared back with the singing teacher, just to cover ourselves and the patient, realizing that that patient does not ever have to release that information. And if they choose not to sign that document, we are not by law allowed to answer questions related to a given patient or singer without that patient or singer's permission. So don't feel like you're being left out of the loop on purpose, but that's something that federal law mandates, that we can't have those conversations or we can get in a lot of trouble. So at the end of the day, preventative wellness, I highly, highly recommend a vocal screen for your singers who are planning this for a career. it never ceases to amaze me how many very high-level elite singers who do hundreds of performances a year have never seen what their instrument looks like, so they don't know what baseline is when they get in trouble. And in trouble may simply mean bronchitis or a cold that's preventing them from performing. It doesn't have to mean a major injury. Our goal in screenings is never to kick people out of programs or make them worried about the jeopardy or make them worried about their career being in jeopardy. It's simply to provide information for them to help them make the best decisions and have an understanding of how their instrument works. If you have any questions about screenings or how we implement them and provide information both back to the student and in my case to the university, please let me know. I do hold an adjunct position at the university as a voice consultant, so I'm a faculty member at the university, and I also teach undergraduate pedagogy and a doctoral commercial pedagogy class, and am on campus with them to help triage their injuries and help these students get the information that they need and get them to the providers that they may need in case of emergency. And so I think this is a super unique situation. I know that the Conservatory CCM was the first in the nation to be able to start providing these back in 2001. So I feel very, very fortunate to be a part of that program. And if you do have questions, please let me know. Images are always important. See if you can get pictures or videos of what's going on, because just taking a look with a mirror is not always an accurate assessment of function. The vocal folds vibrate too fast for us to see that. So stroboscopy is the gold standard for looking at function. I hope you've enjoyed this. I will see you next month in the NATS Wellness Chat. Please check out all the activities at www.nats.org. And if you do have questions, feel free to email those to me. Thanks, it's been a pleasure. Have a great day.